Good afternoon. My name is Kara Manry, and I am the Crisis Intervention Specialist for a 13-year-old female who has recently been suspended from school for pushing another student down the stairs. The incident is pending charges for assault. For simplicity's sake, we will refer to the client as Penelope. Penelope has a very significant history of trauma, which includes being witness to domestic violence, enduring emotional and physical neglect, having food insecurity, witnessing parental substance use and abuse, and being left alone at a young age to take care of her younger siblings. Both of the client's parents are currently incarcerated and have been in and out of jail her entire life. The client reports that she hates her parents, especially her mother, and never wants to see them again. The client's grandmother, who she lives with, identifies that she herself struggles to set boundaries and limits with Penelope's mother, as that is the grandmother's daughter. She states that if she does not help Penelope's mother, then she has no one. The grandmother acknowledges that this leads to calls about visits that are promised but never occur, and unexpected visits from the client's mother. Upon talking to the school, grandma, and the client, it is identified that the client, Penelope, has been bullied for a few months and has told a teacher or two, but nothing was ever done. The school notes that the client should have come to the police officer within the school to report the bullying incidents. Grandmother has shared with the school that Penelope is afraid of law enforcement and has been taught to hide from them. Even with the bullying, the school reports that charges will still be filed due to the student being injured during the fall. Based on information gathered so far, I can confidently state that Penelope's behaviors are an outward manifestation of her inner sense of stability and security, which have been significantly impacted by trauma experienced under the care of parental units in active addiction. Again, for the sake of simplicity, we will refer to Penelope's mother as Tammy. In psychology, we recognize the disease model of addiction, where the substance can essentially hijack an individual's entire persona and really negatively influence their decision-making process. As a crisis intervention specialist, I understand and I empathize with Grandma's complex emotions regarding her daughter Tammy. My job as Penelope's crisis specialist is to advocate for her well-being. Addiction has not only impacted Tammy's life, but it has heavily impacted her daughter, Penelope. Tammy's use of drugs was traumatic for Penelope during her formative years, which were spent in a household that was abusive and neglectful. I am confident that Grandma does in fact have Penelope's best interest at heart. Her grandmother's dynamic with Tammy is emotionally charged. It is not uncommon to see these types of patterns among addicts and their loved ones. We are certainly seeing some enabling here, as well as some minimization that is really harmful for Penelope. I do believe that Grandma would be willing to more effectively prioritize her granddaughter if she were to have a deeper understanding of the situation as a whole, as well as what Penelope's needs are. I would have a conversation with Penelope's grandmother in which I would explain the impact the abuse had on Penelope. Penelope's formative years were spent with her mother and father. They were traumatic for her. She was very neglected. She experienced food insecurity and was exposed to domestic violence. Grandmother may do well to understand how unsafe Penelope likely felt, and Grandma would do well to understand her own role in fostering a sense of safety and security in Penelope's life now. Next, I would get Grandma to understand the importance of autonomy for Penelope, especially after being exposed to domestic violence. Grandma respecting Penelope's boundaries regarding contact with her mother, Tammy, is one great method that Grandma can do to give some of that much needed sense of autonomy back. I am going to encourage Grandma to seek individual therapy, as her daughter Tammy's addiction has been traumatic for her as well. I do want to check in with Grandma throughout the course of Penelope's treatment. Regarding Penelope's legal troubles, it is possible that I may be able to assist. I would be willing and able to give expert testimony regarding her behavior, in which I would shine light on why Penelope may have had the behaviors that she has, and I would also note that Penelope would benefit from psychiatric services rather than something like juvenile detention, which could exacerbate her underlying problems. Being that the incident in which Penelope was expelled from school, being that that resulted from bullying. I do not personally find Penelope to be a danger to those around her, nor herself currently, though I will assess that continuously as I provide care to her. But with that said, I would recommend outpatient therapy for Penelope. I believe that would help her feel the most comfortable. And on that note, my primary goal initially with working with Penelope would be to build a rapport with her. It is important that Penelope feels safe in my presence, not only for her mental well-being, but also to provide her with a safe space where she can feel comfortable to open up to me so that she can process some of her trauma. Primarily, for Penelope, I would utilize EMDR. This is a great method for processing trauma in a way that can keep us from reliving the event. It has been shown to be extremely effective for those suffering from post-traumatic stress disorder, and I do believe that Penelope would really benefit from this. This would require some foresight, though. I want to make sure that Penelope has proper coping skills before we begin this type of therapy. I would utilize calm space for Penelope, in which she and I would cultivate and develop a space in her mind where she can go to ground herself and calm herself. And on that note, grounding skills, I would teach Penelope a series of grounding techniques, some as simple as deep breathing, or some as intricate as categorizing the things around her in alphabetical order. This will be very specific to her and what works for her and what she likes. Grounding skills are well suited to crisis situations, and I think they will help Penelope in getting to a better state of mind, where we can begin working on more complex coping skills. We may consider parts work for Penelope. She may be able to utilize that in much the same way, in a way that she can calm herself. It may be a good coping skill for her. Lastly, I would consider group therapy, family therapy for Penelope, primarily to include her grandmother at this time, as her grandmother is her main caregiver along with her grandfather, and her grandmother does have her issues with setting boundaries with Penelope's mother, Tammy. I think that the two of them would really benefit from family therapy together. I think that Grandma cares a great deal about Penelope, and that the situation is just very emotionally charged and hard to come to terms with for both of them. I can expect to see progress with Penelope as we work through the techniques and methodology EMDR that I am striving for. I will utilize a number of scales to track her progress. I will assess these scales roughly every 6 months or so, and I will adjust treatment plans accordingly.